Hi everyone, this is my video submission for the hematologic discussion. The scenario that I'm working with is a mother brings her 9-year-old daughter into the ED with new onset symptoms of chest discomfort and sharp stabbing pains in her lower back and her abdomen. The mom reports that her daughter's symptoms started after having spent all day out in the heat playing in a weekend softball tournament. The vital signs are a BP of 120 over 82, heart rate of 115, respirations of 18, and O2 is 92% on room air with a temp of 101.6 degrees Fahrenheit. Upon the physical assessment, there was swelling in the child's hands and feet, and they are not her baseline. Her lab work came back. Her hemoglobin is 7.5, hematocrit is 24, platelets are 202, and red blood cells are 2.8. Her mom is concerned and mentions that she's worried because her daughter's always been healthy. So the diagnosis that I chose for this child is sickle cell anemia. Clinical manifestations for sickle cell anemia include swelling and pain in the hands and feet. This is known as dactylitis, often accompanied by fever. The sickle-shaped cells obstruct the small blood vessels, and that causes ischemia and necrosis and pain, and that's why there is swelling in the hands and feet. This is considered a vaso-occlusive crisis. So the pain is described as intense, stabbing, sharp. In addition, the typical locations of pain for this are in the long bones, the chest, the abdomen, and the lower back. So this patient has all of these manifestations. Sickle cell anemia actually falls under the umbrella term of sickle cell disease, which is a monogenetic disorder that's caused by a single base pair point mutation in the beta globin gene. It results in the substitution of the amino acid valine for glutamic acid in the beta globin chain. So it is inherited. As far as nutrition goes, one nutrient for concern for individuals with sickle cell disease is vitamin D. So vitamin D plays an important role in cell growth and differentiation, bone and cardiovascular health, and immunity. It's been reported that people with sickle cell disease and/or anemia have lower concentrations of 25-hydroxyvitamin D, as well as an increased prevalence of vitamin D deficiency. So sickle cell disease is most commonly found of people of African origin. So there is an increased risk of vitamin D deficiency in this population because darker skin pigmentation absorbs less ultraviolet B radiation, so it reduces the skin's production of vitamin D. There is evidence that the pathophysiology of sickle cell disease and/or anemia has substantial nutritional implications during higher energy and nutrient requirements, nutrient deficiencies, and growth abnormalities. It's thought that a main driver of the disease is the complications as higher rates of metabolic expenditure in individuals with sickle cell anemia resulting from increased hematopoiesis, increased cardiac output, chronic inflammation, and related processes. So, since nutrition interventions could be a mechanism for addressing increased energy expenditure, attention to nutritional care is increasingly seen to be an important aspect of supportive management for patients with sickle cell disease and/or anemia. Education and treatment plan for this patient would include the aforementioned information, along with advising the patient and her mother that the sickle cell gene can be identified by a blood test called hemoglobin electrophoresis. It measures the types of abnormal hemoglobin. It can also determine if the hemoglobin is sickled or normal. I would also advise that stem cell transplants may provide a cure, in addition to telling the patient that medications like hydroxyurea and L-glutamate can reduce the frequency of crises. I would also advise the patient to avoid sickling triggers such as dehydration, stress, high altitudes, fevers, and extreme temperatures. Other helpful topics that would be in the care plan would include the use of oxygen therapy, pain management, infection control measures, receiving all vaccinations, the possibility of blood transfusions, bone marrow transplants, and genetic counseling for people with the sickle cell trait. That is my video. Have a great day.